right, so today we're talking about how much healthcare will cost your retirement and really trying to lay out a framework for how we can estimate how much healthcare will actually cost your retirement through all three phases. We have essentially your pre-Medicare years if you're retiring prior to 65. Then we have, again, the majority of those years are going to be Medicare years, which are not free, which can be quite costly in certain circumstances. And then finally, more of those no-go years, the long-term care years. So let's get into it. One of the most common things that retirees communicate to us when we're talking about retirement fears and kind of what we're generally worried about in retirement is healthcare. Okay, 58% of retirees view healthcare as one of the top obstacles in the way of financial security in retirement. And a big reason for that is a lot of statistics that we've commonly heard. For instance, we've seen healthcare inflation rise at about twice the inflation rate of normal inflation over the last 20 years. Prior to Medicare, depending on what type of insurance you're choosing, whether it's ACA insurance or some kind of COBRA, unsubsidized COBRA insurance, healthcare can be quite costly. Okay, it can easily rise above $20,000 per year. As we move through life, the higher income that we show, we may be subject to additional Medicare premium increases, thus increasing the cost of Medicare for us. And then finally, in those no-go years, we've all heard the statistics around long-term care. Over 51% or over 50% of retirees need long-term care, and obviously the expenses for long-term care can vary quite widely. And so we're going to be looking at really a case study in this presentation today and trying to zero in on what healthcare will really cost us in retirement. So adequately planning for healthcare can, I find, is oftentimes or inadequately planned for within retirement plans. And the reason being is because most of the time people include all expenses in one given number. Okay, what I mean by that is, okay, if we look at our income need, okay, let's say we need $80,000 per year. Let's say that healthcare is just going to be $10,000 per year. And then on top of that, we estimate that taxes are going to be an additional $15,000 per year. Okay. Well, a lot of people basically include that all in one income number. Okay. So in that given scenario, that would be $105,000 per year. And then they just simply grow that for inflation. And this is a very critical piece that we want to be separating out our basic living expenses as well as healthcare spending within our retirement. Have those as separate expenses. The reason being is because they are subject and historically have been subject to wildly different inflation rates. Okay. Generally, we're going to want to grow our basic living expenses by a normal inflation rate, basically normal CPI. Healthcare, though, we've seen historically has been at around twice the normal CPI inflation rate. And so we want to include healthcare as a separate expense because that's going to grow. Again, historically, it's been growing by a larger inflation rate. And so if we're including those all in one, we're likely underestimating what our healthcare expenses will be as we move through retirement. We can see this on the screen right here, basically looking at CPI of Medicare throughout US city averages, as well as all items throughout city averages here. Okay. And in our retirement, we essentially have three different healthcare regimes that we will have to plan under and navigate. The first is if you're retiring before Medicare, before 65. And there are some different pre-Medicare options. You have Obamacare, ACA insurance, the Affordable Care Act, public marketplace. How much you pay for ACA insurance is going to depend on how much income you show, how much reported income you show. We'll talk about that here in a second. Then you have COBRA insurance, which is a continuation from work. Generally, that's unsubsidized and lasts for about 18 months. And then sometimes there's health sharing options. So that's generally done through religious organizations, but isn't solely done through religious organizations. That essentially a bunch of people are pooled together and you essentially pay expenses for the other pool and the pool pays expenses for you. And so there's health sharing that can be done as well. That for certain people, especially if they have a little bit better health and whatnot, that can certainly be an option. We're primarily going to focus on ACA insurance here in this presentation today. From then, once you turn 65, Medicare starts, and we'll talk about all of the expenses that we should be planning for on the Medicare side of things. And then finally, in those late years, we have those no-go years, the long-term care years, which obviously can be very expensive. Now, with pre-Medicare insurance, we can get to a point where we're paying very little. Okay, if we're able to earn a very large subsidy by reporting a low income, that can lead to very cost-effective insurance. It can also lead to, if we don't earn a subsidy, as we'll show, very expensive insurance. And so that's a very wide gap that comes back to planning and what we can do with inside of your retirement plan to either earn a large subsidy, thus lowering healthcare costs, or maybe we're forgoing a subsidy in order to perform larger conversions and things like that. Again, we'll touch on that. Then from the, basically once Medicare starts, the expenses are a lot more static through time. Again, we might see higher adjustments if we're showing too much income, but we really don't have too many strategies where you can drastically cut your Medicare expenses. There really aren't strategies available from there. And then long-term care, obviously there's long-term care insurance policies. There's different ways that you can deal with long-term care expenses. There's some certain riders that you can add to health, life insurance and things like that. We'll touch on that very briefly as we move through this presentation, but really we're going to be focusing on a case study here. And obviously with any case study, there's a lot of variability that can happen here. So we're going to focus on Bill and Sarah. They're both 62 and life expectancy for Bill is 85. For Sarah, it's 94. Now, we're generally running out life expectancy a little bit longer than just in general to build a more conservative plan. But it's not out of the question that we could see, again, a married couple live to these given ages. Okay, Bill is at about a medium risk, meaning that he has some underlying health conditions that might translate to him owing a little bit more for out of pocket, or at least having a little bit more care that he would need. And then Sarah's pretty healthy as a whistle, if you will. Great longevity, no underlying health conditions. And so again, as we think about her healthcare costs, she's likely going to be owing less and having less care on an ongoing basis till maybe those later years. So as we start to illustrate costs through this, I stripped down this graph right here. There's going to be a little bit more information as we move through this that's applied to these given graphs. But really, we're going to be looking at first healthcare costs under normal historical healthcare inflation. I'm using 5% as a healthcare inflation rate for those given costs. Then we're also looking at what I would consider low inflation on the the floor of expenses here, and that would be basically normal CPI. So assuming that basically if we were going to meet that floor, it would be that healthcare costs rise to normal CPI. It's interesting that as we've been seeing this very high inflation over this last year, the one thing that hasn't been as high of inflation, again, inflation's been around that 7% range over the last 12 months. Healthcare costs have actually not inflated at the normal CPI. So whether that's here to stay, whether that's we're going to go back to seeing historically high healthcare inflation, that has yet to be seen. And then on the upper end, basically including an upper end ceiling there for higher than average healthcare inflation. Okay, I'm using 7% for that. Okay, and so let's first touch on the pre-Medicare years. Okay. And so with pre-Medicare years, again, when we're focusing on ACA insurance, the amount that you pay for ACA insurance is going to depend on your reported income. So if you're able to report a fairly low income, you will likely earn a very large subsidy. And thus, a subsidy will affect you in two ways. It will lower both your monthly premium as well as your out-of-pocket, your deductible, essentially. Okay. And so what's included inside of this reported income? It's based off something called healthcare modified adjusted gross income. It's one of those MAGIs in the tax code that can be a little bit confusing because there are multiple MAGIs and modified adjusted gross income numbers within the tax code. All wages and distributions, taxable wages and distributions. A big one that oftentimes people don't consider is untaxed Social Security benefits. So if you file for Social Security at 62, let's say both Bill and Sarah filed at 62 and they were receiving $35,000 from Social Security. That would be counted dollar for dollar against them in terms of reported income, even the untaxed amount. So your full Social Security benefit is counted against you in terms of reported income here. Then basically most normal other things will be counted against you. Pension and annuity income, that's taxable. Any long-term or short-term capital gains, just that taxable gain will be counted against you. Passive income, unemployment benefits, and interest are all counted as reported income. So there's a tug of war that has to happen at the beginning of retirement in those early years before Medicare. We're trying to take a large income, let's say in that $80,000, $100,000 range, but we're trying to report a low enough income that we can earn a large subsidy. And so that's a tug of war that can happen. The two accounts that we can use in order to artificially report a low income are going to be our taxable account using capital gains. Because again, if we think about it, let's say we have a $100,000 taxable account, our cost basis might be something like $75,000. So when we're selling $1 out of that given account and taking that as income, only 25% of that dollar, 25% is capital gains that would be counted against you. And so this can be a good way to essentially take a high income but still report a low income. The other thing that isn't counted in this equation is Roth withdrawals as well. So we can use those two assets strategically to take a high income but still report a low income. And when we're talking about ACA insurance, there's essentially 4 different plan categories, from bronze to platinum. And very generally, this is kind of how the breakdown will work. The bronze plans will generally be the cheapest, but you will have to cover more out of pocket if you have ongoing expenses. The deductibles will generally be larger. Co-insurance, you'll have to cover more from that standpoint. And basically, as you move up the ladder, the opposite is true. Platinums will be the most expensive, but you'll have to pay the least out of pocket. So somebody that is very healthy, let's say Bill and Sarah were both extremely healthy, haven't gone to the doctor in the last couple of years, maybe they want to take a bronze plan to pay a little bit less out of pocket and hope and kind of risk hoping that they have less medical expenses on an ongoing basis, so they'll have to pay less out of pocket. And if somebody was, let's say, high risk, let's say they had numerous underlying conditions that time and time again they notice that they have quite a large amount in medical expenses, they might want to move towards a platinum plan. Okay, so let's first kind of walk through, if they're going to need ACA insurance for 3 years, what expenses should they be illustrating within their plan? So first, we're going to look at no ACA subsidy. Now, this is going to get a little bit difficult because right now we're under a current healthcare regime that is very forgiving. The American Rescue Plan for 2021 and 2022 instilled in a plan that basically took away what was previously known as the subsidy cliff. So if you showed more than 400% of the federal poverty level, and you can look this up for your you can look this up for a household of 2. It's based off, or you can look at this up, I should say, for your household. It's based off household. For 2021, I believe it was at 68,960. And so again, under the subsidy cliff, once you showed over that amount of income, you essentially lost your subsidy. Well, the subsidy cliff was replaced by more of a subsidy hill, if you will. And so you're able to show a lot larger income and still earn a subsidy in 2022. So we're going to be looking at this underneath the subsidy cliff. So they're looking at taking $80,000 of income. Underneath the subsidy cliff, this would mean that they would lose a subsidy. And so we're going to be looking at a silver plan and also looking at basic dental plan as well. And so we see with earning no subsidy for 2 people, health insurance is quite expensive on a monthly basis. Almost $2,100, basically $2,100 when we factor in the dental plan, okay? And you can look all of this up on the healthcare.gov. This will vary by the zip code that you live in. So we're looking at Wisconsin's, just basically the state we live in, and looking at that given healthcare calculator. But you can go to healthcare.gov, type in your information, type in your estimated income, and look at the given options that you have. You can also go over here to estimated total yearly costs. And this will basically have you put in what kind of health risk you're at. So if you're in very good health, they'll basically assume you don't have too many health visits. If you're at high risk, they'll assume you have quite a bit of health visits, and thus you will have a higher total yearly cost. So this can be a great way to look at plans and start to gain an understanding on how much Medicare healthcare will cost you, okay? But we can see here that it's quite expensive. The deductible, if they need healthcare, is quite expensive as well. And so when we're illustrating this within a plan, again, we have basically in total yearly costs, including out-of-pocket costs, we're essentially looking at $28,000 in healthcare premiums and out-of-pocket costs, plus this dental plan here. And so when we start illustrating this right off the bat, the good news is this is a very short amount of time that they would be taking from ACA insurance, okay? But we can see that when we start to increase this for inflation, cost of unsubsidized insurance is quite costly in the early years to our retirement. Again, spending a little bit over $28,000 at 62, and that increases moving forward into the future. By 64, they're spending a little bit over $31,000. And essentially, if we add these together for these 3 years, so I'm going to continue to show these type of charts that essentially show this moving through time. You'll notice that, again, when we're only looking at 3 years, inflation, whether it's higher or lower, doesn't have that large of a drag on our retirement. But nonetheless, any way you slice it, with unsubsidized insurance on a silver plan, this person is spending almost $90,000 in those first years of their retirement just for healthcare. So some of those healthcare concerns that retirees have, I think, are completely warranted, especially when we're looking at unsubsidized ACA insurance. Now, what happens if they earn a subsidy? So in this sense, they're essentially still taking the same amount of income, but using certain assets within their retirement in order to report a low income. So we're still using a silver plan, we're still using a basic dental plan, but now they're earning a fairly large subsidy. So their previous plan, that would be $2,073.98. They're receiving a $19.50 tax credit per month. Okay, so that's that subsidy. And so their healthcare costs lower substantially, right around that $100 mark, $120 mark, if you will. And so when we use the same estimated yearly cost, for one thing, we notice their deductible and out-of-pocket maximum both lowers because of that subsidy. So a subsidy helps you in two ways, lowering your insurance premiums as well as out-of-pocket costs. And we see that their total yearly cost drops significantly. Okay. Now, again, we still have to add in the dental plan here, but now we're looking at a completely different paradigm in terms of this person's early healthcare needs. Okay. Now, rather than spending almost $30,000 a year, they're spending essentially 20% of that, about $6,000 per year moving through time. And again, inflation is still a drag, but again, inflation obviously is a much larger drag in terms of dollars on a larger amount, let's say $28,000 that they're spending on their healthcare versus $6,000. And now they're spending right around that $20,000 range on healthcare for the first 2 years, or first 3 years. So saving $70,000 in income. So when we talk about strategies to build into your retirement plan, and we talk about you not needing more money, you needing a better plan, this is exactly what we mean. Okay, using your situation in order to earn a subsidy and eliminate a large healthcare cost from your retirement in those early years will save quite a bit, as we see here. Okay, so that's ACA insurance. Let's start moving to Medicare now. Now, there are a few different parts of Medicare. Medicare can oftentimes be confusing. It seems like every government plan, whether it's Social Security or Medicare, is oftentimes some of the most confusing parts around retirement. Well, let's kind of briefly go over each of these parts. Okay, so Medicare is not free. Even though you've been paying into Medicare for most of your working life, you've probably seen from your pay stub, you're paying in 1.45%. Your employers are also matching that 1.45%. That's basically just paying for Part A insurance. So Part A insurance doesn't carry an ongoing premium if you have qualified by having enough credits and earning years and things like that. That's that 1.45% that you've been paying in essentially takes care of Part A insurance. Part B insurance, you will still have an out-of-pocket premium that you owe on an ongoing basis. Same thing with Part D insurance. Okay, Part C insurance is either traded out for a Medigap or you take that Part C insurance. Okay, so that would be Medicare Advantage or a Medigap. Okay, it's one or the other. You generally don't take both, I should say. Okay, so again, there will be ongoing expenses that we owe here for Part B, Part C or Medigap, as well as Part D. Now, historically, Medicare premiums have risen at that historical Medicare medical inflation rate. Okay, so if we look back into the 1990s, okay, Part B premiums right around that $30 range. Currently, as of 2022, they sit at $170.10. Now, this is per person. Okay, you don't get to be lumped together just because you're in a couple. So Medicare is per person, and we'll cover what all of the expenses that you may owe and what we want to essentially expect for Medicare costs moving through time. Basically, premiums have grown by 5.5% inflation from 1990 until now. So again, we've seen that high medical inflation rate subject to Medicare as well. Now, from a Medigap option standpoint, there are a lot of different options available. Okay, even depending on what state you live in, which complicates things even more. For instance, Massachusetts, Minnesota, and Wisconsin standardize Medigap policies in a slightly different way. But for the majority of states, you essentially have 10 different supplement options that you can choose from A to N. All of these are marked with letter name. And as you can see, these will cover different things. Essentially, you purchase a Medigap policy to essentially fill in the costs, the deductibles, the excess costs that the other parts of Medicare will have. So we notice here that, again, based on Part A, Part B deductibles, certain plans will cover that deductible, certain plans won't cover that deductible. So this is always something, whenever we're talking about the exact ACA insurance plan that you should end up choosing for your situation and the exact Medigap or Part C policy that you should choose for your situation, we highly recommend talking to an independent Medicare agent or medical insurance agent because again, we can always, basically illustrate things within your plan and make sure that we're building the costs within your plan. But as far as whether, depending on what prescription drugs you currently take, depending on what care you need on an ongoing basis, that's certainly something where you want to talk to a specific medical insurance agent on that front. Okay. There are 3 different ways that your premiums may be determined. There's something called community pricing, which basically, regardless of your age, for Medigap policies, you pay the exact same. That's a little bit less common. There's an attained age pricing model that will adjust as you move through time. And then there's what is the third one? Anyway, there's 3 different ways that your premiums may be determined. Most of the time, or majority of the time, your premiums will likely rise as you get older, if you will. Okay. So we're going to use, just for simplicity here, we're going to be assuming community pricing for your Medigap policy. But let's start to look at all of the costs that will be associated once you're on Medicare. And again, Medicare will obviously be the longest type of medical option that you are on throughout your retirement. So first we have Part B. Part B insurance right now, or Part B premiums right now, cost $170.10 per month. That translates to $2,041 per year. Part D, the national average is $43 per month. This covers prescription drugs. That translates to $615 per year. For Medigap, again, this can vary quite widely based on age, based on the pricing model and whatnot. That's at we're assuming $130 per month. That translates to $1,560. Then we also always want to be assuming some kind of out-of-pocket charge. Now, this will obviously vary quite widely. There may be a year or a few years where you don't have any normal doctor visits. You're healthy throughout those given years. There might be other years where you have, a specific health condition that causes you to owe a little bit more in out-of-pocket. So the out-of-pocket will likely be something that's a little bit more random in given situations, but something that we, again, want to basically attach some kind of cost assumption to. So we're attaching $88 per month, $1,059 per year. So total annual costs per person is $5,275.20 here. Okay. Now, I'm not going to be illustrating any IRMAA, but it's important to know and understand what IRMAA is. So again, I mentioned at the front end, if you show too high of income, you may owe extra expenses in terms of your Medicare premiums. This is based off your AGI, okay? And it's also a 2-year look back. So what I mean by AGI is you don't get to take the standard deduction. And again, it's a 2-year look back. So basically what income you show at 63 will determine what your costs are at 65. If you're still working, you can file for an appeal. But generally, this comes up in terms of either RMDs, if your RMDs are too large, or if you're performing Roth conversions to try to avoid large RMDs moving forward into the future. Again, we're not going to be illustrating this just for the sake of simplicity here, but just keep that in mind. Obviously, your Part B premiums, and this is what would also be subject to Part D premiums, can skyrocket quite a bit and translate to significantly more that you will owe in Medicare premiums. So how do we illustrate this then through time? It's important to understand that, again, for this specific case study here with Bill as well as Sarah, they're basically going to be paying both Medicare costs until basically Bill passes away. And then obviously Sarah only has her Medicare costs. So that's why you see this basically this bend within the chart right here. This is essentially when Bill passes away. But then we're illustrating this throughout their entire life. And Medicare will carry them through the rest of their life. And so we can see that, especially with Medicare inflation rates, this can grow to be quite a large sum of money. Yeah, on the low end, assuming normal inflation rate for Medicare costs, we're looking at this couple spending almost $376,000 in Medicare costs. On the top end, looking at spending almost $750,000. Now, it's important to note here just the impact that higher inflation can have. Again, intuitively we know this, but it's difficult to wrap our heads around compound interest. And so having just a couple percent higher inflation rate, we can see basically doubles their overall Medicare expense. Now, again, this is a fairly wide gap that we see here. And again, a big reason for that is because of inflation, but that middle zone is right around that $550,000 range. Okay. So again, Medicare can be quite costly as we move through time. Let's touch on long-term care lastly, and then we'll kind of bring it all together and talk about how we can start to plan for this within our retirement. So long-term care there's a lot of statistics out there. It's a difficult thing to plan for, just full disclosure. The reason being is because this is going to be an expense that we're trying to plan for 30 years down the road potentially. Okay, and so the medical landscape is changing. Long-term care, I'm sure, will change drastically as we move through the decades as well. But there's a lot of statistics that can further offer a little bit more context around long-term care. For instance, over 50% of retirees need long-term care, but oftentimes retirees need long-term care for a very short amount of time. Again, if we think about it, entering into long-term care generally means that you cannot basically take care of yourself, if you will, and you don't have other people that can help take care of you. And so at that point, when we enter that phase of our life, the clock is somewhat ticking at that point as well. So we generally see not too many people having a ton of time that they spend in long-term care. Depending on where you live, the median annual cost of a nursing home can vary quite widely. The cheapest state as of these statistics, cheapest state was Texas at around $55,000. On average, $85,800, and then Connecticut was the most expensive of all. So depending on what state you live in, these can vary quite widely as well. And then most people, the vast majority of people, don't owe anything out of pocket for long-term care. There's a lot of reasons for this. Again, if you don't have the retirement assets in order to afford long-term care, essentially the state and the government essentially takes care of you. So that's a big reason why there's not a lot of out-of-pocket expenses here. Outside of this, the rest of these expenses are varying quite a bit for the length that somebody needs long-term care, whether somebody's self-funding or whether they're using long-term care insurance and whatnot. So in order to gain a estimation for what we want to assume for this analysis, we're essentially going to use the Vanguard Estimated Healthcare Costs Calculator. It's a pretty nice calculator that can kind of show you what to expect for costs moving through time. You'll note that if you go to this calculator, a lot of those costs that we've already talked about will match up in terms of Medicare, in terms of ACA insurance and whatnot. And they basically break it out into percentiles because, again, we don't know exactly how much one specific person is going to end up needing in long-term care costs. So we dive back into just normal statistics. And so if we're looking at Bill and Sarah, the reason Sarah's is generally a little bit more is females tend to spend a little bit more time in long-term care. Again, health span essentially being a little bit longer, spending a little bit more of those years in long-term care as well. The other thing to note too is as we're illustrating this we're basically going to break this up over a 3-year period, these costs. Again, not assuming that they all happen in 1 year, but rather that they happen over time. The other thing I want to note is this is basically assuming that Bill and Sarah both enter into long-term care. This is generally unlikely with a married couple. Reason being is because typically when one person has those given needs, the other partner can be a little bit of a caregiving source, thus avoiding long-term care to an extent. So also what I did is I essentially discounted Bill's expenses because, again, normally that's what we see happen. Again, there may be the possibility that both people enter into a long-term care facility. Obviously, we'd want to illustrate that both separately. But again, trying to accurately assess it and try not to do too much fear mongering on the side. I think on the healthcare side of things, there's way too much fear mongering trying to get people to purchase insurance contracts that generally don't make as much sense because, again, if you have this huge looming fear of a $250,000 expense down the road in long-term care, it can lead you to make some steps and measures that might not be best for your situation. And so now when we add in long-term care costs at the end of each person's life or towards the end of each person's life, and we also add in the ACA insurance as well as the Medicare insurance, we start to gain an understanding around total cost. Now, this is going to be a little bit of a sticker shock. The reason being is because this is illustrated in future dollars. Okay, so this is illustrated with inflation. We should discount this in order to gain a good understanding of what this would cost in today's dollars. Okay, so in future dollars, okay, essentially on the high end, we are spending quite a bit on insurance. Now, note that this is quite aggressive in terms of inflation. We're using a 7% inflation for healthcare over the next, essentially, what is that? 30 plus 33 years. Okay, so quite drastic inflation. If we see normal healthcare inflation, we're looking at right under $1 million, again, in future dollars that we'll be spending and putting towards healthcare. And then on the low end with normal CPI, $623,094. The reason that I say keep things in mind here, keep the context in mind is because, again, we need to be keeping in mind the impact of inflation. So for instance, when we look at just purely your spending need, let's say $80,000, Well, 15 years growing at 2.5% inflation, we now need $115,000 just to spend the same amount that we spent when we were spending $80,000. Okay, we need raises in our income in order to have that same purchasing power. Same thing with, again, 15 years after that. We need over double the amount of money, just growing at 2.5% inflation, 30 years down the road to buy the same things we were in year one of our retirement. So you'll often notice, again, when we don't essentially pare back numbers for inflation, we notice some of these numbers, like we just saw on the screen, grow very large. So what happens if we illustrate this in current dollars? So basically taking out normal CPI. We're still going to include essentially the effect of healthcare inflation here, but discounting normal CPI here. Okay, and now we see still very large numbers, but more understandable for our retirement. Okay, on the bottom end, we're essentially looking at contributing $420,000 in healthcare costs throughout our retirement. In the middle case, looking at historical normal healthcare inflation right around that $623,000 mark. And on the high end, almost $900,000. Okay. So any way you slice it, healthcare is quite expensive to our retirement. Okay. But again, keep this in mind in how much we're spending from our retirement as well. So this is basically a couple's income need through time. Okay. And it's basically showing $80,000 of starting income. This isn't looking at any source that money's being taken from, just they're spending basically through time. And we notice, again, looking at slightly different inflation levels here, we're looking at, if I'm not mistaken, 1.5%, 2.5%, and 3.5% here. We notice that this person is spending quite a bit throughout their retirement. So when we look at healthcare relative to what they're spending throughout their retirement, again, looking at healthcare on top of this $80,000 spending need, again, we still look at healthcare being quite a large expense. But in relation to everything that we're spending, again, it is just an expense. Okay, it's not something that it's something that we obviously need to plan for, but it's not something that's going to control our retirement. Okay, but that being said, this all shouldn't be a point of fear. This wasn't a fear-mongering case. This was to accurately illustrate and make sure that we're planning correctly. This isn't a point of fear. This is a point of planning. As I said off the front end, too many mistakes that I often see when we're building a retirement plan, no matter how many bells and whistles you have in a retirement plan, whether you're running just a spreadsheet, whether you're running a Monte Carlo, whether you're running whatever you're running. Okay, if you put garbage in, you're going to get garbage out. And so one of the most important things to illustrate properly within a retirement plan is income need through time, how much you will be pulling from your assets. And that means separating out certain expenses. So that means separating out your normal income need, both what you need to live on and also what you want to live on from a desired lifestyle spending standpoint. Then we need to illustrate in healthcare costs. Again, the reason we want to separate this out is because of that assumed higher inflation rate on medical costs. We can see that one of the biggest expenses for healthcare is not even healthcare right now, but healthcare as we move forward in the future. We need our portfolio, again, when we're thinking about the inflation rates that we have to overcome within our portfolio, overcoming healthcare inflation is a sizable rate that we need to overcome. And then again, understanding that healthcare costs are going to change through time. So when you first enter ACA insurance, whether you're earning a subsidy or whether you're unsubsidized, that is a completely different expense than when you will be on Medicare. And then obviously long-term care. So that's a change in expense. Same thing with taxes. That's exactly why you want to separate taxes out within your plan and not just assume a $10,000 spending goal or spending need for taxes. Taxes will change based on, if you're doing conversions, if you have large RMDs, based on which accounts you're pulling from, based on what your income looks like on an ongoing basis, and will likely change drastically over time. If it's not, you're likely doing something wrong within your retirement plan. So again, healthcare planning shouldn't be a point of fear. It should be a point of planning. We want to make sure that you're adequately planning for this goal so that when we think about retirement, our main goal for you in retirement is peace of mind. And I really think peace of mind is gained by having a well-built plan. So rather than worrying about what healthcare costs are going to be in retirement, if you're planning for it, we can overcome that given hurdle and overcome that given fear. So hopefully this video was informational. Always remember, you don't need more money. You need a better plan. You need to plan for healthcare costs and how they change through time differently than other income pieces in your plan.